and we medicate the heart anyway, generally for a crime it's not committing, when there's an 85% chance it's actually something other than the heart. And we never look to the microvascular circulation. We never look to the 70% of our circulation that's actually not done by our heart. What are we doing to cater to that 70% of our circulation? Well, things like resveratrol, hydrogen gas, lowering our homocysteine, which is, for most people, is very simple to do. I use an amino acid called trimethylglycine to help people metabolize homocysteine, because those microvasculature is very susceptible to high levels of homocysteine. And there's so many people that have ailments that are consequences of poor circulation, and we're treating something completely different. So, for example, poor focus and concentration, lots of autoimmune conditions. If you look at the circulation in the brain, liver, lungs, pancreas, kidneys, you'll see that the majority of this circulation is microvascular. You know, I've talked about why you and I both had a positive experience, for example, with red light. What is red light doing to our eyes? Is it fixing the rods, the macula, the cones, the retina? Was there something damaged that red light fixed? No, it just restored healthy vasomotor activity to the back of your eye, which is why I never wear protection in a red light bed. Now, am I saying a red light bed is going to cure your eyesight? No. I'll get so beat up for that. But red light therapy is extraordinarily good for vasomotor circulation. Why do you think it improves your skin? The collagen, the elastin, the fibrin. Why do you think it reduces fine lines and wrinkles? Why does it improve? Why can it improve our eyesight? Because it restores healthy vasomotor activity. And there's so much microvasculature in our body that we don't really cater to this entire segment of our circulatory system. Think about how small a capillary, an artery, has to be to carry a fluid to the edge of the lung, exchange a gas with the inside of the lung, pull that gas into the fluid, and not bleed into the lung. So just think about how tiny that tube has to be, and how many of those you have to have